Hello and welcome. Today, we're going to delve into colorectal cancer, a disease that affects the colon and rectum, the lower parts of your digestive system. Understanding this cancer, its causes, and available treatments is crucial for early detection and improved outcomes. So, what exactly causes colorectal cancer? The truth is, there's no single cause. It usually develops from precancerous growths called polyps that form on the inner lining of the colon or rectum. Over time, some of these polyps can change and become cancerous. Several factors can increase your risk, including older age, a family history of colorectal cancer or polyps, certain genetic conditions like Lynch syndrome, inflammatory bowel diseases such as Crohn's disease and ulcerative colitis, a diet low in fiber and high in red and processed meats, obesity, smoking, and heavy alcohol consumption. These risk factors don't guarantee you'll get colorectal cancer, but understanding them can help you make informed choices about your health. Let's explore the pathophysiology. Colorectal cancer typically begins as a benign polyp, often an adenoma. As these polyps grow, they accumulate genetic mutations. These mutations disrupt normal cell growth and division, causing cells to proliferate uncontrollably. These abnormal cells can invade the lining of the colon or rectum, then spread through the wall, and eventually to nearby lymph nodes and distant organs like the liver and lungs. This process, known as metastasis, makes the cancer more difficult to treat. The mutations often involve genes that regulate cell growth, DNA repair, and apoptosis, the process of programmed cell death. Colorectal cancer is a significant public health concern worldwide. It is one of the most commonly diagnosed cancers in both men and women. The risk increases with age, and it's more prevalent in developed countries, likely due to lifestyle factors. However, incidence rates are increasing in younger adults as well, which is a worrying trend. It's important to remember that early screening can significantly reduce the incidence and mortality rates of colorectal cancer. The symptoms of colorectal cancer can vary depending on the size and location of the tumor. Early-stage colorectal cancer may not cause any symptoms at all. However, as the cancer grows, you might experience changes in bowel habits, such as diarrhea or constipation, or a change in the consistency of your stool that lasts for more than a few weeks. Other symptoms include rectal bleeding or blood in your stool, persistent abdominal discomfort, such as cramps, gas, or pain, a feeling that your bowel doesn't empty completely, weakness or fatigue, and unexplained weight loss. It's crucial to see a doctor if you experience any of these symptoms, especially if they persist or worsen. Early detection is key in treating colorectal cancer. The gold standard for diagnosis is a colonoscopy, where a long, flexible tube with a camera is inserted into the rectum to view the entire colon. This allows doctors to identify and remove polyps or take biopsies of suspicious areas. Other screening tests include stool-based tests such as the fecal occult blood test, FOBT, and the fecal immunochemical test, FIT, which look for blood in the stool, and the multi-targeted stool DNA test. A sigmoidoscopy, which examines only the lower part of the colon, may also be used. Imaging tests like CT scans and MRIs can help determine the extent of the cancer and whether it has spread. Colorectal cancer is classified based on several factors, primarily the extent of the cancer spread. The TMM staging system is commonly used. T refers to the size and extent of the primary tumor. N indicates whether the cancer has spread to nearby lymph nodes. M indicates whether the cancer has metastasized to distant organs. These factors combine to determine the stage of the cancer, ranging from stage 0 very early to stage IVs advanced. Different types of colorectal cancer include adenocarcinoma, which is the most common, as well as squamous cell carcinoma, carcinoid tumors, and gastrointestinal stromal tumors, GST. Treatment for colorectal cancer depends on several factors, including the stage of the cancer, your overall health, and your preferences. Surgery is often the primary treatment, involving the removal of the tumor and surrounding tissue. Chemotherapy, which uses drugs to kill cancer cells, may be used before or after surgery to shrink the tumor or prevent recurrence. Radiation therapy uses high-energy rays to target and destroy cancer cells. Targeted therapy and immunotherapy are newer approaches that target specific molecules involved in cancer growth or boost the body's immune system to fight the cancer. A combination of these treatments is often used for optimal results. Following treatment, regular follow-up appointments and screenings are essential to monitor for recurrence. There are several steps you can take to lower your risk of developing colorectal cancer. These include getting regular screening tests, especially after age 45, eating a healthy diet rich in fruits, vegetables and whole grains, and low in red and processed meats. Maintaining a healthy weight, exercising regularly, quitting smoking, and limiting alcohol consumption are also important preventive measures. Talk to your doctor about your individual risk factors and the screening options that are right for you. The prognosis for colorectal cancer depends on the stage of the cancer at diagnosis, as well as the individual's overall health and response to treatment. Early detection and treatment significantly improve the chances of survival. Recent research has led to advances in targeted therapies, immunotherapies, and minimally invasive surgical techniques, which have improved outcomes for patients with advanced disease. Research continues to explore new ways to prevent, detect, and treat colorectal cancer, offering hope for even better outcomes in the future. Thank you for learning about colorectal cancer today.